Patient Jordan arrived at the hospital this morning with complaints of chest pain. He's a little nervous because this is his first ever hospital stay.
In this scene, we have Dan, the student nurse, getting the handoff report with Anna, the ongoing nurse, from Megan, the outgoing nurse.
Let's observe.
Patient Jordan is a 30-year-old male who came in this morning complaining of chest pain. He is on telemetry. He is a little nervous because it's his first day in the hospital. He is awaiting a stress test and may have a few questions for you about it. Otherwise, he's just finished lunch and we are keeping him for observation.
Okay, Dan, so your patient is in room 171, bed 2. Go ahead and introduce yourself to the patient and complete a quick assessment to make sure his environment is safe.
Don't worry, I got this. Hi, so
Hi.
you're Jordan.
Yep,
Jordan's you.
that's me.
Okay, just wanted to make sure. I'm just going to make sure your room's safe and I'll be back.
Okay.
Okay?
Sounds good.
Alright, well, everything seems to be safe here. See ya.
Okay, so how is everything with the patient?
Well, she was fine. Her room was safe and everything, and she didn't need anything, and she wasn't in any pain, so she's good to go pretty much.
Okay, well, can you go back in now and complete the rest of our assessment?
Sure.
Okay.
Well, Jordan, I saw a few things wrong with that scene. What did you see?
Well, nobody introduced themselves. Dan was playing on his cell phone and wasn't paying attention, and he didn't verify that he understood the nurse's instructions.
Well, that was pretty rough, so...
Okay, so Jordan, I hear you've been having some chest pain. That's what I see in your chart here that I've been looking over.
I'm actually here because I had knee surgery. They just moved me up into this floor because there was no more bed.
Okay, well, how are you feeling?
Good.
Okay, so your chest, nothing here. No chest
Just
pain.
there.
Just there. Okay. Would you mind if I looked at your bracelet real quick?
Sure.
Alright, I'll be right back.
Okay.
Okay, so I'm a little confused. I'm not quite sure what you were talking about before because our patient isn't having chest pains. So I don't know what to interview her about.
What do you mean? What are you talking about?
Our patient, I went in and talked to her and she said she wasn't having any chest pain. She had a knee replacement.
Our patient is in room 171, bed 2, 30-year-old male Jordan Smith.
Did you mix them up? Are you sure?
No, I'm positive.
Okay. I'll be right back.
That was really quick. This is a really good example of a bad assessment, starting with Dan didn't even check if this was the right patient or wash his hands before he entered.
He didn't check anything else as far as safety goes. He didn't see if the bed needed lowered. He didn't clear a pathway. He didn't check the side rails or if there was items that she needed in reach.
Also, the wires he didn't even check for, and the call bell could have been anywhere. He didn't put it by her. And lastly, he didn't ask if she needed anything before he left or tell her when he would be back.
Hi. Are you Jordan?
Yeah.
You're Jordan with the chest pain.
Yeah.
Okay, so what's the situation here?
Well, I was at home and felt a little thing in my chest. And then I got really nervous and I started talking. My mom got all worried about it and I talked more to her and then she,
Okay, so do you have any allergies?
Yeah.
You do? Okay. So what do you want to tell me about your chest pain?
It seems better now.
Better?
I don't know.
Okay, so you're not having it now, or?
Not at the moment.
But you're still in the hospital?
Yes.
Okay. Well, I think that's it. Bye.
Bye.
Okay, Dan, so what new information did you gather about our patient?
Well, he doesn't have any allergies, and he seems to be doing fine. I mean, I don't even know why he's still in the hospital.
Is that all the information you got?
Well, yeah, I mean, he's fine. He's feeling okay. So.
Okay, well, I'll go back in a few minutes
out.
just to check and finish up everything, okay?
Thank you.
Once again, this was a very bad interview, starting with no tolerance rules. He didn't use either hand washing or identifying the patient. He doesn't knock or introduce himself or his role to the patient.
He didn't listen. He didn't try to make conversation. He didn't ask the right questions, and he didn't use solar and try to form a relationship with the patient.
And once again, he doesn't say when he'll be back or even if he will be back.
Hey Megan.
Hi.
How are you today?
Good, how are you?
I'm good. Well, I'm going to have your patient today, and this is the student nurse Dan.
Hi, good to
Hi,
meet you.
nice to meet you. I'm Megan. Okay, so our patient is Jordan. He's a 30-year-old male. He came in this morning complaining of chest pain. He is on telemetry. He's a little nervous because it's his first day in the hospital. He is awaiting a stress test and may have a few questions for you about it. Otherwise, he has just finished lunch and we are planning on keeping him for observation.
Okay. Do you know what time the stress test is at?
This afternoon.
Okay. Anything else I should know about him before we go in?
No, I think that's it.
Okay.
Okay, Dan, can you go in and do a quick assessment and make sure the patient's environment is safe?
Sure, it'd be my pleasure. I'll be right back.
Let's start with the handoff. First, they all introduce themselves and their roles. Second, you can see Dan is paying attention by asking questions and taking notes, and also at the end he verifies the handoff.
Hi. How are you today?
Pretty good. How are you?
Good. My name's Dan. I'm going to be a student nurse talking to you today. Is it okay if I come in and spend some time with you?
Yeah, that's fine.
Okay, I'm just going to look around your room real quick and make sure everything's safe, and then I'll be right back.
Okay.
Okay? Let me see. Do you need this?
I don't know.
No?
It's just that.
here. Okay. I'm going to just tuck this back here. Okay. Let me just take a look at your bracelet real quick. All right. Could you spell your last name for me?
SNITH.
Okay. And what's your first name?
Jordan.
And your date of birth?
March 23rd, 1982.
Okay. Thanks, Jordan. Just going to put these up so you don't fall out of bed. The bed seems to be a little high. Good job.
Last nurse. Actually, I lied. I was playing with the controls.
Don't do that. We just want you to be safe. Okay. Do you need a phone here?
Not at the moment.
Hi, how are you today?
Hi.
Hi. Okay. Okay. Is there anything you need that I can bring you when I come back?
A little cold. I could use another blanket.
A blanket? Okay, sure. I'll get that for you.
Okay, so how did everything look? Tell me what you noticed.
Well, everything looked fine. His room was clean and stuff, and he's comfortable. I'm just going to go get him a blanket before we go in and talk.
Okay,
Okay.
so when you get the blanket, you can go back in and complete the patient-centered interview, okay?
Okay, sure. I'll be right back.
Thank you.
That was a great example of a 60-second assessment. He asked if he can enter, and then he did zero tolerance. He washed his hands and checked the patient's ID to make sure it was the right patient. And then he did the safety things. He lowered the bed, made sure the side rails were up, made sure he had everything he needed beside him so he couldn't fall trying to reach his items. He made sure he had the call bell, and then made the environment comfortable by asking if he needed anything before he left.
Hi. Hey, I'm back. Sorry, what was your last name again?
Smith.
Smith. Okay, spell that.
SMITH.
And your date of birth again?
March 23rd, 1982.
Okay, good. All right, I got your blanket.
Thank you.
There we go. Is there anything else I can get you
No.
before we talk?
No, I'm okay.
All right.
Thank you.
Comfy?
Yeah.
Good. Good. Okay. All right. So, Jordan.
Yes.
Can I call you Jordan?
Yeah, I
Good.
prefer that.
Okay. What else can you tell me about what brought you in today?
I just had some chest pains, and then I wasn't too concerned about it, but I talked with my mom, and she was really, really nervous about it, so I thought it'd be best just to come in.
So she got you to come in.
Yeah, more to get her off my back.
Do you live with your mother?
Unfortunately,
Or
yes.
you do? Okay. Do you take care of her at all, or?
No, she's independent, but a little bit of financial
She
support,
like,
I guess.
oh, okay, yeah. So she was the one who kind of pressured you, though. So
Yeah.
how would you describe your symptoms?
Just had chest pain, and sometimes you get it and it just goes away. It just didn't really go away, so
Right.
it's best to get it checked out.
Right. But did you agree with her that you should have came in here today with us, or
Eventually.
would you have come in on your own? Okay, good. All right. So, what's it like living with her? It seems like it's causing you a little bit of stress.
A little bit. I mean, when you're 30 and your mom moves in, it's not
Yeah.
the stuff you're used to.
Yeah. Anything else causing you any stress right now?
No, not too
No.
much.
But you think she's going to be staying with you for a while, huh?
Indefinitely.
Yeah, indefinitely. Well, you take good care of her, it sounds like. Okay. Well, looking at your chart here, any illnesses that she had or that anyone else in your family would have had that could have caused, like, anything in
No,
the history?
not really. I mean, my dad has high blood pressure, and my mom has low blood pressure. So.
Okay. So, some blood pressure issues in the family. Any allergies that you know about?
Yeah, penicillin.
Penicillin, and what does that do when you have penicillin?
I just get a rash.
A rash? And when was the last time you had that happen?
I couldn't tell you when I was little.
You were young? Okay. All right. Do you work at all?
Yeah, I'm a construction worker.
Okay, where do you work at?
I work for PennDOT.
PennDOT, okay. Good, that's a good job. Any medications you take every day, or
I take baby aspirin.
baby aspirin to
Yeah.
help with your heart?
Yeah.
Okay, but that's it?
Well, multivitamin. I don't know if that counts though.
Yeah, we like to keep track of that, definitely. Do you know what the dosage of the aspirin is?
That's the baby one, so it's the small
Not, you
little
don't know
dose.
milligrams like
No,
5 or...
I'm not sure.
Okay. All right. Well, anything else you want to tell me right now, or?
No, I'm pretty good.
Good?
Healthy. I think I'm just gonna rest for a little bit.
Okay. So nothing else you need I can get for you, or just some time to get some sleep?
Yeah, just need to rest a little bit.
Okay, good. All right. Well, good to meet you.
All right.
I'll be back in.
Nice meeting you.
All right. Call out if you need anything.
Okay.
All right?
Thank you.
Okay, so how did everything go?
Well, it went really well. I learned a little bit about his history and his life here. He has an allergy to penicillin that gives him a rash, but he can't remember last time he had it. He has some blood pressure issues in his family on both sides, high on his father's and low on his mother's side. He seems like he's pretty healthy other than that. He lives with his mother. She's who had him come in today. She put a little pressure on him to come in. He's a construction worker for PennDOT, and he takes an aspirin, a baby aspirin, is what he said, every day, and a multivitamin. But other than that, nothing.
Okay.
He seems to be doing well. He's getting some rest right now.
Okay. Okay, so what would you recommend I do with this patient?
Well, I think for now we should just place him on a heart-healthy diet and just wait for the results of the stress test. And maybe check his blood pressure every 4 hours.
Okay, very good. Thank you for the recommendation.
Okay.
The interview was very centered around the patient. Dan starts by asking if the patient's comfortable before he starts the interview. He asks the patient's preferred name and starts with small talk with open and close-ended questions.
He used the Gordon's model to make sure he got all the information he needed from the patient.
But even after the Gordons, he asked if the patient has anything else to say to have a complete assessment.
And then to make sure he maintains a relationship with the patient, he used solar during the interview, which is sitting, open posture. He leaned towards the patient, maintained eye contact, and remained relaxed.
He also remembered to use zero tolerance. Both in and out of the room, he washed his hands and verified the patient.
And then afterwards with the nurses, he made sure to use SBAR, which is a situation background assessment, and then his recommendation for the patient.